I'm going to get this FDG. It's a fluorine atom attached to a sugar. This is a lead L block to protect me from radiation exposure. Inside you can see the syringe. It's labeled. I'm going to check the label, make sure it's correct. And I'm trying to do this very quickly because this is radioactive. I'm going to put it into the dose calibrator to measure its current activity. Half-life is 109 minutes. It decays relatively quickly. Okay, I'm going to go get my patient.
Radiologists read and interpret a number of different types of diagnostic imaging studies. X-rays, ultrasound, CT, MR, and PET. So our job really is to interpret the imaging studies and try to help make a better diagnosis.
Where's your happy place? Think about a happy place.
Oh, I have lots of happy places. Mm-hmm. In 2017, it was found that I had breast cancer stage 3C. I have an aggressive kind. They were hoping they got it all through a mastectomy and hard chemo, regular chemo, and then radiation with a chemo pill.
The earlier a cancer is diagnosed, the better chance the patient has of surviving, and the more limited the therapy. The value and the magic of PET-CT, if you will, is in the name, PET and CT. So the PET image, positron emission tomography, is a way of measuring radioactive activity throughout the body.
All right, let me check your blood sugar really fast.
Mm-hmm.
Tumors burn sugar. The tumors we are interested in are the ones that are cancerous or malignant.
Okay, Kerri, I am going to go grab your dose. That's the radioactive sugar that's in saline, so no side effects, no allergic reactions. And then you're going to be in here for 50 minutes so that it can circulate throughout your body. Okay?
So if we place a small amount of a radioactive sugar into a patient's bloodstream, the tumor is going to take up much more of that sugar than any other part of the body. As such, when we then take the PET image, the tumor is going to look hot. The tumor is going to be a bright spot on an otherwise dark background of the body.
Knock, knock. Hi, are you ready?
I've had at least one with the new scanner.
It's lovely, isn't it?
But because my cancer markers in my blood are coming down so far with my treatment right now, they want a new baseline.
Okay, that's awesome though.
Yeah, it is very awesome.
Good for you.
So I'm very excited to see how this comes out.
The CT side of the study provides high-resolution anatomic imaging. So pulling it all together, you have the CT image on the left upper, the PET image on the left lower, and then the fusion images combine both the PET and the CT into a single colorized image. When it comes to precision DL, it takes the current state of PET-CT and makes it even better. This is an AI-based method for acquiring images more quickly and still getting high resolution and sharp pictures.
Your scan's going to take probably anywhere from 6 to 8 minutes. It's super quick, which is great.
Oh.
Okay.
Early PET-CT scanners were north of 30 or 40 minutes for an entire study. If a patient moves, the pictures don't line up.
Kerri, you're doing great. I'm moving you into the PET position. Once it gets there, your scan will start. The total time is going to be 7 minutes.
We could not find early spread to the lymph nodes unless the lymph node was at least 8 millimeters in diameter.
The precision DL makes the images significantly clearer, and radiologists are able to see smaller lesions than they have previously been able to in some other scanners. They're beautiful pictures. Hi, Kerri. You're all done. You did great.
Finding early spread of cancer to lymph nodes or to other parts of the body when that cancer is 3 or 5 millimeters rather than 8 millimeters may make the difference in weeks or even months of the patient being able to receive treatment earlier. So this is Kerri's prior PET-CT, also performed with and without precision DL, and it's the reason a follow-up study was requested. Applying precision DL causes the activity in both of these nodes to jump out against the background, making it obvious that both of these lymph nodes have some degree of cancer involvement. I want you to focus on this image from Kerri's PET CT from 6 months ago, showing activity in both of these very small lymph nodes in her left neck. Moving over to the left, we see that a PET CT image from the exact same location in her neck shows that that activity is no longer present, and the cancer in both of those nodes has responded to her therapy. Now, with the current level of technology with precision DL and PET imaging, we're able to provide very rapid, very accurate results to patients and their doctors. We couldn't have done this 10 years ago. We couldn't have done this 5 years ago. And I think 5 years from now, we'll be doing things that we can't do now.